Hello everyone. My name is Dr. Maneesha PH. I am Senior Consultant Neonatologist at OM Hospitals, Bangalore. Today, we are going to discuss the module Transporting a Sick Neonate, which will be discussed in three parts. I am going to take care of the first part of it, that is, components and the preparation. Nurses, you are the backbone of the NICU. You are the important link in the neonatal transport chain. So, this topic is very important. So, let's get started. So, identifying a newborn which needs to be transported requires also a triage system. What is a triage? Triaging is basically to identify which baby is more sick, very sick, and which baby requires the transport at first, and then considering the transport. In this link, the first part is what are the components of this neonatal transport and how do we prepare for it. We just don't prepare before the transport, but it has to be an ongoing process so that anytime there's a transport call, we are all set and ready to receive the baby. Then comes his pre-transport stabilization, communication and medico-legal aspect. But today's module will be more about components and preparations only. So what is the problem? So let us talk about the burden of the problem. India is a country which has 125 billion population and more than about 25 million live births per year. Unfortunately, more than 40% of our neonates die in first 24 hours of admission. These babies are often critically ill, and the outcome also depends upon whether they need whether they received the proper care or been shifted to a center where they could have received the proper care. In India, the neonatal transport system facilities, especially in a suburban and village areas, are very dismal. Most of the neonates are transported without any pre-transport stabilization or care during the transport. Any vehicle is used, which generally takes long hours, and babies are placed in boxes which are not well recognized as well. There is acute shortage of neonatal beds, and majority of the sick neonates who are in need of urgent admissions are dumped in pediatric wards and sometimes are shunted from one health facility to another. So, why the transport of the sick neonates is necessary? That is because neonates deteriorate very faster than adults. If we transport the babies at right time, in the right way, to the right expertise, with the accompanied personnels who are also trained, it decreases the mortality as well as the morbidity. We can correct these problems in newborns if we can make the specialized care available. Majority of our deliveries still happen at home. Approximately 60% are happening in the rural areas, in the nursing homes or in the hospitals with the extremely limited resources. The babies who are transported from the outside hospitals are found to be many a times hypothermic, blue, cyanosed, hypoglycemic, and 75% of such babies transferred in this way have serious clinical implications. So, to improve the outcomes, to decrease the morbidity and mortality, it is important that we transport the sick neonates in a proper way. So, what are the components and the preparations which we are going to tackle or talk about today? The first thing is the goal? What are we planning? What is the goal of properly transporting a newborn? What is the definition of it? The indications for the transport. What is NTA? That is Neonatal Transport Team. The equipments which are required to be checked and ready before the transport. The ideal vehicle for the transport. And then the paperwork which includes the transport form and the consent. So let's get started. So, what is our goal? Our goal of transporting a neonate is to transport a right newborn. When I say a right newborn, that means a baby who is sick, a baby who has to be transported at the right time before it becomes very sick. It should be accompanied by the right specialist, people who are trained in neonatal resuscitation and who know about essential newborn care, to the right place, that is, from the place where there are limited resources to a place where this baby can be taken care of. If the baby needs a cardiac surgery, baby should be transported to a cardiac center. If the baby needs a neonatal specialty, the baby should be transported to a neonatal intensive care. By the right form of transport, from the ideal vehicle, receiving the right care throughout the transport by the right specialist. So many rights, but that's our goal for neonatal transport. So we want it right way. So what is the definition? So definition of a neonatal transport is to shift these premature sick babies from hospitals without ICU facilities or places where there are extremely limited resources to the hospitals where there are intensive care specialties where we can tackle such sick newborns. The transfer types can be emergency or unplanned, where the baby has been delivered and suddenly have developed a respiratory distress, or it can be planned, where a mother is going to deliver a premature baby, it's been anticipated, or when there is an antenatal diagnosis of any of the congenital diaphragmatic hernias. So these are all planned or elective transfers. Majority of our transfers are emergency, where we have not anticipated the things. So, what are the indications of the neonatal transport? When the babies are sick, when the babies are not being able to manage in the center where they are born, it's important that we shift the babies to a center where they can be managed properly. So it can be the commonest cause is the respiratory distress, which can be in term babies or the preterm babies. The second common cause is prematurity, the babies who are born less than 36 weeks, who are less than 2 kgs. Presence of sepsis is the third common cause. Seizures, any abnormal movements, any dehydration, any lethargy, not able to suck, extremely yellow baby with palms and soles jaundiced, a baby who is not feeding. These are common causes of the babies who require neonatal transfer to a expertise center. To add on, it can also be sometimes the procedures of the diagnostic facilities, like if the baby requires an X ray or ultrasound, which is not available in the parent hospitals, the baby needs to be shifted. A baby who has not cried immediately after birth and has not been developing a spontaneous respiration needs to be shifted. A baby who requires a surgery or there are congenital anomalies which need to be tackled like meningomyelocele, such babies needed the transfer. So let us look at a case scenario that we receive a call of a 34-weeker, a baby who is low birth weight, about 1.8 kg, has respiratory distress, a Silverman Anderson score of maybe about 7 by 10. Baby has recessions, baby has ranting, baby has developed these symptoms after birth and is delivered in a referral nursing home, which is about 7 kilometers away from your hospital. A transport call has been given for the retrieval of this newborn. Now, how should we be ready? What are our next steps? Or what is our stepwise approach? We are going to discuss this in a stepwise way. So, how are we going to deal with this? So, what are the key components of the neonatal transport system? That is, when we have received a call of a neonatal transport care, how are we going to approach this? The first thing which is required, the important thing, is the human link, that is, the human resources. That we have to have a neonatal transport team who will be able to take this call and able to go for a transport. The second thing is the proper equipment and a transport bag which will take care of the things which are required for managing or stabilizing the baby. And the third important thing is the ideal vehicle or the transport vehicle to transfer or retrieve this newborn. We are going to talk about these first two components in detail now. So, when we talk about neonatal transport system, it is important that we allocate the proper roles. As in cricket, the captain decides about who will bowl first, who will be on mid-off, who will be at the boundary. He is the one who manages the entire show. In transport system, we will have a doctor, a expertise, a specialist who will manage the transport team. So, what comprises of a skilled transport team? So, the team should include a doctor who is trained in neonatal resuscitation, a doctor who is trained in neonatal resuscitation, and the nurses. Depending upon how sick is the baby, you need to have either one nurse or two nurses. A Group G worker as a support staff, and an ambulance driver who will help you out to retrieve the baby in neonatal transport incubator. It's important that the team leader does the right allocation of the work. Depending upon how sick is the baby, you will take along with you the staff who will be expertise enough to manage such babies. Whenever, as we discuss the case, the call comes to the hospital, there should be a dedicated call number which will be available for all the transport services. When a call comes to the hospital, the transport system or the neonatal transport team, the entire system should get activated. There should be one call which is dedicated for the neonatal transport. So, how do you prepare for it? The preparation, the training should happen on a daily basis. It should happen on since the time the nurses have been recruited. There have to be a unit guideline on the neonatal transport that whenever we are transporting the newborn infants in the critical condition, what are the checklists which we have to carry out when the transport call comes? There should be a simulation and training of the nurses, the doctors, the Group G workers that if there is a call, how are we going to manage? And this should happen on a weekly basis or a monthly basis, and we should actually simulate this, which will help us when there is an actual transport call. So, what are the so after the neonatal transport team, the next thing which we are going to discuss is about the equipments, the equipment resources. What are the equipments which are needed for the hospital neonatal transport? So there should be a checklist which has to be regularly updated and indented. The checklist, which is always kept ready in the transport carry bag, so that whenever there is a call for the neonatal transport, the team and the equipment and the vehicle should be ready or mobilized within the record 10 minutes time. So there has to be a pre-departure checklist also on the equipment which has to be before transport, which we have to check. So this is our equipment checklist which we have kept it on the transport bag. Just before going, the nurses will check all these equipments whether they are there or not, But on a regular basis, as you check the crash trolley, the neonatal transport bag has to be checked, as the transport can come in the middle of the night as well. So, what are these equipments? So the important thing is the maintain the TABC, that is the temperature, airway, breathing, and the circulation. To maintain the thermal support for the babies, we need to have a transport incubator, a thermometer, a temperature monitoring probe. A baby who is less than 30 weeks, you need a cling wrap or a plastic wrap, an insulating blanket, or sometimes the embrace, which keeps the baby warm. When there is an indigenous way where we are transporting the babies from the rural areas, we have had thermocol boxes with the cotton to keep the babies warm. I'm talking about the ideal transport incubator and a system which should have at least the embrace. The transport incubator will be really ideal. Next is to maintain the breathing, as the respiratory distress is the commonest cause of the babies requiring transport. So, what do you need for these equipments? We need at least two oxygen cylinders and one air cylinders. There are hospitals who will be transporting the babies for over 300 to 400 kilometers. So, in that case, we need to make sure that the oxygen cylinders are more enough to maintain the oxygen supply throughout the transport. We should have the flow meters, the oxygen tubings, the adapters, the neonatal size mask, the preterm term, neonatal positive pressure ventilation bags, the AMBU bags, the TP's resuscitator in case the baby has to be transported on ventilator, pulse oximeter to maintain that the baby has a target saturation throughout the transport and we give a right care throughout the transport, laryngoscopes, the ET tubes, the batteries, the ET straps. Extra batteries, very, very important. And along with the respiratory equipments, suction catheters and the nasogastric tube to complete the list. Sometimes the baby may develop sudden respiratory distress on a transport. It is better to have the chest tube insertion trace as well. Other monitoring equipments include cardiac monitors, glucometers, stethoscope, cardiac monitor in case you are transporting a baby to a cardiac center. We also require the infusion equipments which include neoflons, syringes, the alcohol and betaine swabs in case we have to start the baby on the IV line then and there, splint and the micropores, also, the PMO lines, the micro drip sets, because smaller babies, after starting the IV lines, we have to start them on the IV fluids so that they maintain the they'll be euglycemic throughout the transport. IV fluids, which should include 10% dextrose, normal saline, sterile waters, calciums, vitamin Ks, and sometimes if we're transporting a baby with seizures, we need to carry anticonvulsants as well. Adrenaline is also a very important drug which has to be kept in the transport bag. All this equipment should be written on a checklist which has to be indented and updated regularly by the nursing in charge or a dedicated person is designated to do this job. And pre transport or pre departure, this has to have a pre checkup. Very important point to note that a pulse oximeter should have a battery backup and should be charged 100% beforehand in case we have a transport. There should be a pulse ox which is dedicated for the transport. An alternative current 240V power source can be provided in the ambulance with the adapter as well in case it doesn't work on a battery. Oxygen supply also should suffice the entire journey of transport. So we should know what is the distance which we are covering in transport. If it's a short distance, one cylinder can suffice, but if it's a longer distance, you need to carry 2 to 3 cylinders. Always keep spare cylinders and equipment to change the cylinders. Most of the cylinders, generally the transport incubator, they do not last for more than 2 hours. So if your transport is Requiring more than that time, we should be ready with the extra cylinders. It's important to have this transport quality matrix. So, what is this transport quality matrix? The transport quality matrix tells you the performance of the transport team. It tells the performance of the transport team that how early we have taken the reference acceptance time to the total transport time. The earlier is the better. If we prepare and train ourselves in from the day one, not just before the transport, we can achieve this within 10 to 15 minutes. So, what is the referral acceptance time? That is, once we receive the call of the referral, how early we accept if the doctor is not available. You find out from the doctor and then give the call to the referral facility saying that we are ready for the transport. Mobilization of the transport team, that is when the call comes to this dedicated number, the first thing which is to be mobilized is the human resources. So make sure that the neonatal transport team is ready. Then second one is the equipment check, that is also ready. And you dispatch that you leave the hospital from the transport call time is 10 minutes. If you can achieve that, it's really good. Stabilization and response time depends upon how sick is the baby once you have reached the referral facility. The total transport time, that's why, may vary, but the dispatch time, that is the time from which you have received the call till you have left your hospital to reach the referral hospital, it should be within 10 minutes. This is a quality improvement project which we can definitely achieve with the proper preparation and training. So, what are the different types of neonatal transport? As we discussed before, there can be a planned transport or there can be a unplanned transport. Most of the transports what we see are the unplanned transport. So as you can see in this picture, there are indigenous transports where the baby is being transferred by their own vehicle. In baby is been given kangaroo mother care and baby is being kept warm and then transferred. And you can also see on the right hand side a baby is transferred in a thermocol box which is wrapped in a cotton. So this is the indigenous way. The ideal way to transport the baby is through the transport incubator, which will maintain the baby's temperature, which will maintain the baby's humidity. That's the ideal way. The safest way to transfer the babies is in utero. That is, mother's womb is the safest incubator for the baby. So that's the best way to transport the baby if antenatally we are expecting a delivery who is a premature. Speedy retrieval, high cost, is to the helipad. Possible in India, it's happening in India, but more commonly we'll talk about the other transport which are more common. So, which are the different ways by which the babies have been transferred? The babies are transferred in a transport neonatal ambulance. The transport vehicles have been the vans, the mini trucks, sometimes the mini vans. The speed of such vehicles is generally a little more than the permissible load limits, about 10 to 20 miles per hour. Adequate stabilization and preparation should be done before we start the transport. So the types of transport include either from home to hospital, or it can be within the hospital if you have a delivery and the operation theatre and the neonatal intensive care unit in different blocks. To facilitate the transfer from a regional center to a center which requires a cardiac specialty or a neurological specialty, a retrieval from a peripheral hospital to the NICU or a specialized newborn care unit, or it is a reverse transport where the baby is being transported from the hospital to the home. So these are different types of the transport. Now, what is the ideal transport vehicle? The ideal vehicle is the ambulance which is used for the neonatal transport should meet the requirement of a basic life support ambulance. It should be spacious enough so that it can accommodate the neonatal transport incubator, ventilator, monitoring devices, oxygen cylinder, suction apparatus, and minimal two seats for the transport staff. It should be at a height so that the transport incubator can fit. It should have fastening of the equipments. It should have the fixation of the transport incubator to the cot rails, an independent power source, and an adapter. So that is for the ideal transport vehicle. Most of the ambulances in India are the makeshift of the commercial vehicles like SUVs or the mini trucks, which are modified to the specification of the purchaser or the neonatal ambulance. It's important that we switch on the incubator before starting the transport so that when we reach the referral facility, the transport incubator is warm enough and will ensure the thermoregulation. So, this is about the ideal transport vehicle. Then comes its important documentation and the transport form and the consent. Now, this has been taken again in the next modules. It will be taken in detail. I'll just go through quickly through these documentation details that there should be a sample transport referral form that why we are transferring the baby, the importance of maternal history, the birth details, what are the duration of pregnancy, what is the gestation of the baby, what is the sex of the baby. This is all is very, very important. Resuscitation details, how the baby was resuscitated there. If you have gone for transport for attending the delivery, this is even more important that we jot down all these details. What is the treatment given? Where are we transporting the babies from? Who is the accompanying person? And it's important we tell them that why we are transporting the baby, inform them, and take their signature. So, this is a sample consent form which tells you that it's important to take the signature of the doctor as well as the signature of the parents or the attenders, that they should know that what is the condition of their baby and why the baby is being transferred. What is the course of illness? What may likely be duration of the stay, and the treatment has to be explained to them before you transfer the babies. We have come to the end of the first session where we are just recapitulating on what we have studied before, that what are the common causes of transport, what are the types of the transport, which can be emergency or it can be planned, it can be different types of the neonatal transport where it can be from home to hospital, from hospital to home, or intra hospital. What are the important transport vehicles and an ideal neonatal ambulance? There are different types or modes of transfers the babies can. What are the principle of the safe transport, communication, evaluation, and the pre-transport stabilization will be discussed in the further modules. The last but not the least, the summary of this module is if we need to achieve the transport metrics, that is, as I told you, from the referral acceptance time till the dispatch time, it's important that we are very, very organized and prepared and are trained. So, trained in terms of neonatal transport team, allocating the right work by the team leader, preparing and the equipment, the pre-equipment checklist, and it should be ready beforehand, and there should be an ideal transport vehicle. All these things are very, very important to transport the right baby at the right time through the right mode of transfer at the right facility, giving the right care throughout. Thank you very much. I hope this module has helped the sisters uh, to prepare well in advance in terms of equipments and preparing and training themselves so that whenever there is a transport call, the neonatal transport team, the system should get activated, the human resources and the equipments have to be checked. We will discuss the pre-transport stabilization and the medico-legal associated things in the further modules. Thank you very much.